This is the second part of our two-part series on WHO, UNICEF, hand hygiene in community settings guidelines. So this morning we talked about evidence and research, what's out there, what do we do with the evidence that's out there, how does that inform recommendations. Part two is really, I suppose, the demand end of this sort of challenge, which is thinking about how those recommendations, those evidence-based recommendations, can be taken up and used by different actors, first and foremost, national governments, but also other actors, different agencies at different levels, international, national, and local. So we're talking about the same stuff, but we're taking a slightly different one, different perspective on this, and we've got a really exciting agenda to bring this to life. So we're going to have a quick recap on the evidence assessment. So we're going to hear again from Bethany. She's going to run us through the evidence, because I think some people here, I think probably about half the room weren't here this morning, so it'd be useful. So we're clear on what is the evidence that we're talking about. We're then going to hear from Joanna from WHO, who's going to open that black box around what happens in the guideline process, because a lot does happen, and I think for people who use guidelines, it's sometimes a bit mysterious as to how these recommendations were arrived at, and whether it was just a couple of people in Geneva. The answer is no, it wasn't, that sort of cooked these things up. There's a really long, interesting process there, which is both about evidence, but it's also about consultation. We're then going to move into this sort of question of taking guidance to implementation. Broadly, this is the process for the WHO guidelines. This morning, we talked about scoping and evidence assessments. Bethany talked about why did we ask the questions we asked of the research, of the evidence base. How did the team at Emory then retrieve and synthesize all of that evidence? So that's block 1 and 2. And that's what Bethany's going to run through very quickly. The second bit in this process is then taking that evidence, guideline formulation, arriving at the recommendations, and then publishing that guidance, getting those guidelines out into the public domain. That's what Joe's going to describe. The conversation we want to have with you are those 3 red boxes at the end, which are sort of hard to make out, so I'm going to read them out. National policy adaptation. So we say adaptation because the guidelines are a starting point for building on existing government policy. And obviously how those recommendations are implemented will look very different in different places. We can talk about the actual implementation of the recommendations, and then ultimately, if all of these things happen, the theory of change for the guidelines is that that will lead to impact around the things that we're concerned about, so public health outcomes, improved quality of life, etc., etc. So that's the structure for the session. Basically, Bethany, Joanna, and then all of you, those last 3 blocks. So, Bethany, over to you again. I don't know how she does it, but she's going to make systematic reviews exciting. Yeah.
And so, for those of you who were also here last time, it was a longer, this is not going to be as long, it's going to be really, really rapid, so hopefully you won't be repeating too much. So there's something in the middle of the screen here that I just want to
close. Yeah, pointers and the batteries.
Maybe just move it.
Oh,
okay.
I think it's in case when you can join, and it's not there. So.
Is it this thing?
Yeah.
Oh, it's there. Okay. Okay, good. Okay. So rapid review the evidence. Oh, there.
This needs to come up with showing on
So I'll start talking anyway. So basically, a quick, not super in-depth point about the methods that we went through for these systematic reviews, just more to show and point out. Sorry, I can't get this to move forward. Is that gonna go? Okay. That we reviewed a lot of literature, okay? We did a two-phase process where we reviewed and identified eligible literature for this work. But after considering that we did everything for confidence and how we found everything and screened everything and then extracted everything, at the end of the day there was over 100,000 screenings of titles and abstracts, around 10,000 full-text reviews, and extraction from over 1,000 articles. So one of the things I mentioned earlier is that we're pretty confident not only in the information that we presented and synthesized, but we're pretty confident also in the information that doesn't exist and that we need to get. Really briefly, we had 5 major systematic review topic areas around effective hand hygiene, minimum requirements, behavior, and government systems. And for each question, there were sometimes several sub-questions with their own criteria for actually being eligible to be included in the review. In all, while we had 5 reviews, we were really asking and answering 22 different systematic review questions. So these could have been 22 different systematic reviews. We obviously, now have 4 minutes. We're not going to go through all of them, but I'm going to do a highlight of each of them. I'll show you what the questions are. On the bottom, there are going to be, for each of these, I'll put on the slides, but not note some of the gaps we had. The first one, the first paper focused on what are effective strategies for removing and deactivating pathogens associated with disease transmission. And there you go. Okay, thank you. Thanks so much. So what we did is we looked at soap and water, alcohol-based hand rub, and looked at bacteria and viruses. To orient you to this table, for efficacy, a log reduction over 2 is commonly an accepted target in what we're looking at here. First, looking at soap and water, those numbers are over 2, so really good. Soap and water perform well for both bacteria and viruses. What we also see here, though, is that number is under 2 for ABHR and other antiseptics. So while this might appear that these don't work as effectively, what's important to know is that we actually had very little data in this zone, so there's actually a need for research here, specifically considering that we don't have that much data on non-enveloped viruses, coronaviruses, RSV, and influenza, which is really important. Paper 2 looked at what the minimum requirements are for sustained practice of effective hand hygiene. There were only 37 papers that were eligible for this. So what do we mean by minimum requirements? We're specifically talking about quantity of water, quantity of soap, location of hygiene materials, equitable access, and numbers of users of spacing. We had some learning from here, but it was really, really quite limited. In part because what we were looking to answer wasn't necessarily answered. So there was data available on the presence of hand washing stations, but not on the location. And there was information maybe on the presence of soap and water, but not on the quantity of soap and water. So these are areas of research that we really need to dive deeper on. The third question was around behavioral barriers and enablers to practicing hand hygiene. For this, we used the COM-B model. I'm not going to go over what the COM-B model is specifically, but I am using it to sort of orient some of our findings. The main one being that very consistent barrier in the literature for hand hygiene was the availability of soap, the cost of soap, water availability, so things that are considered physical opportunities. The environment wasn't conducive to people actually practicing these behaviors. We also see that a barrier was reflective motivation. People prioritize their time differently, and also automatic motivation. People didn't have a habit. Conversely, habit did motivate people to wash their hands if they had it, but another motivator was perceived health risk. People really thought there was an acute health risk that motivated hand washing. For the fourth paper, which is on hand hygiene interventions, there was a lot that we covered here. everything from understanding what theories, barriers and enablers, intervention functions, behavior change techniques, and design features have been leveraged, and if they've been leveraged effectively. There's a lot in there, so definitely look to that paper for more information, but I'm going to give you 3 top-line points. The main one is that the majority of these interventions were reported to be effective at improving hand hygiene. But because we didn't have any consistency in setting, intervention, population, and even the outcomes, we couldn't compare them. There was also a lack of alignment between what was indicated as an enabler or a barrier and what the interventions actually decided to do. So for example, very few studies indicated that action knowledge was in fact a barrier and enabler, but 190 studies actually acted on that. That raises questions about efficiency and effectiveness of the interventions and potential waste. And then finally, barriers and enablers are most often intervened upon in this body of work were not necessarily those that have been previously identified as critical. So I gave you the example of availability of soap and water being really important, a key barrier for hand washing. Other reviews have also found the same, but the majority of interventions actually don't provide water and soap. They just try to motivate people, for example. It's really hard to be motivated to wash your hand if you can't do anything about it. And I would actually say that that's potentially harmful. There's a lot of needs still in this area, specifically around ABHR and soap alternatives. I will mention that because there weren't a lot of interventions there, and also interventions with those who are disabled. The final review was on government measures. We really wanted to understand what government measures have been implemented, which ones have been effective, and if they have investigated sustainability at all. What we did is we used the 5 building blocks identified by Sanitation and Water for All, and they're up here now. And what we did is we categorized the 75 government measures that we identified across the 31 included studies. We created an evidence map, and basically what we saw is that most of these government measures were in domestic settings, and most evaluated capacity development or sector policy strategy, but very few evaluated sector financing interventions. In terms of impact, about half, a little bit more than half, evaluations of those measures were shown to be effective, and these were covered across all of those building blocks. Now, when we looked into those 45 specific government measures, we found that among those, only 4 measures were evaluated for or assessed for being sustainable over time. So we need more work there as well. And specifically for the government, there was a lot of need for work in public spaces. I'm going to just stop my rapid review by just sort of taking a nod to the very, very extensive team at Emory that worked to review this, and hopefully they would be okay with the super fast super fast
This is
overview.
working now, so.
Oh, good, yeah.
It occurred to me, I didn't introduce Bethany because we had the session this morning, but Bethany Caruso was a researcher at Emory University and led the evidence review team, which included Matt Freeman and Marlene Wolf, and then lots of their colleagues, I think a dozen or so sort of people. Yes, so thanks, Bethany. I will introduce you, Joe. So Joanna Stevens-Mills, who's in the WHO sort of WASH unit and has been leading on the WHO side in the development of the guidelines. So over to you, Joe.
Thank you. So what I want to do in the next 15 minutes is to explore a little bit more. We did discuss in the first session this morning with the panel, we discussed a little bit about how we've taken the evidence that was presented by Bethany to recommendations. The panelists were a number of GDG members with an academic background who were able to speak to some of the challenges associated with that journey from evidence to guidance, where there's scarce evidence or question marks. How did we do that? And I think they gave some really kind of tangible and interesting examples. But what we didn't have in the session in the morning was an outline of that process, and as Ollie described it, sort of that sometimes considered a black box, and how does that happen? So that's what I want to focus on today, and in the 15 minutes I'll do a bit of that and then also present to you the recommendations themselves. Because we've only got 15 minutes, the recommendations will just be sort of the top line, and I'll emphasise that because the guidelines document is really worth reading. Even though the recommendations themselves, the top line recommendations, don't go into the detail, the guidelines do, and they provide a lot more guidance that is worth looking at. So just to re-review then the guideline development process, in this session we haven't looked at the scoping phase, but it's important to flag that there was a phase that preceded the evidence assessment that Bethany described, where we very consultatively developed a set of questions that needed answering, that the hand hygiene community and member states perceived to be lacking, or where there was discordance in guidance. So we've carried that out. We've heard from Bethany on the evidence assessment, and what really we're going to look at now, and you'll have to forgive me because Bethany taught me how to do transitions to slides just before this session, so there's rather a lot of that in my slides. That's very exciting. So this transition from evidence assessment to guidance formulation. In the previous session, I also flagged to you that, broadly speaking, we have three main groups that have helped us develop these guidelines, and it's important to emphasize this because I think it's important to understand that these are groups that are independent of each other. And so we have the WHO UNICEF steering committee that really steered us through the entire process. We have the systematic review team, which Bethany led at Emory University, and independent to both of those bodies, we have the guideline development group. This guideline development group is comprised of 23 members. It's a multidisciplinary group, or was, composed of individuals from across WHO regions, with a balance of gender and geography, with no conflicts of interest as documented. And it was a diverse group, including all of these different people. You might not be able to read the screen there, but certainly we had representatives of end users, so member states, governments, who might be using this guidance. We had representatives of disadvantaged groups who might benefit from the outcomes of using these guidelines. We had practitioner representatives as well, and then we had a whole host of technical experts, microbiologists, epidemiologists, behavioural scientists, and experts in evidence assessment who were on this group of on the guideline development group. And their function in this process was not to scope out the questions, was not to assess the evidence, it was to take all of that and to formulate the recommendations. And they did that by taking into account the summary of the evidence as presented by Bethany, but also to the right of the screen, also a number of other criteria. And you can't see that diagram here, but on the next slide you'll be able to see it a bit more clearly. So really to consider aspects beyond just, for example, whether soap or alcohol-based hand rub are more effective at removing pathogens, but other aspects as well that need to be considered. So that was their function. And there was an extensive process that spanned over a year, from receiving the evidence summaries from Emory University to formulating the guidance. I don't expect you to read it, and we will go through it. The first step here, the evidence to decision tables. So this is what I was briefly describing just there, and you can see it a bit bigger here. We have this framework that was developed by WHO that enables us to move from evidence to decision, and making sure that we're considering all factors that are important, not just the balance of health benefits and harms, not just whether one product, hand hygiene product, is more effective at removing pathogens than others, for example, but also whether there's a social or environmental impact, the relative cost and affordability of different products, the extent to which they're acceptable in communities, the feasibility of rolling them out within health systems. All of these considerations are quite neatly encapsulated within this framework that has 7 components, and which we analysed each and every one of those for each of our 22 questions, hence the extensiveness of the process. Just as an example, so we developed a table like this for each of those 22 questions, and you can see that we have our 6 criteria, or WHO integrate components there. a balance of health benefits and harms, human rights and socio-cultural acceptability, the health equity question, societal and environmental implications, financial and economic considerations, and then feasibility and health system considerations. And for each of these questions, what we wanted to do is make sure that we had the best available evidence within the constraints of our budget, and also that we were asking GDG members to provide a judgment as to the significance of each and every one of those components according to the question. So the first step was to ask the GDG to provide us with either evidence that they were aware of, or an opinion or a view on the importance or the relative importance of these different components. So we asked our GDG members to help us fill in these tables. The second thing that we did was ask them to form a judgment on the relative importance of each and every one of those factors. And we compiled all of this data, and it enabled us to have quite a good view across our 23 GDG members of where the areas of discordance, disagreement might be, on which questions we might be able to identify disagreements. And that's where I really wanted to focus the discussion, because GDG members are volunteers and there are a number of questions to get through, and we wanted to do this in the most efficient way possible. So in May 2024, we had a 2-day GDG meeting where we had a good sense already of where the areas of disagreement were, and we crafted our agenda accordingly, and we allow space for GDG members to discuss and arrive at unanimous consensus on these questions. And let me tell you, it wasn't easy. We had some examples early this morning as to some of the areas where there really was substantial disagreement. And we had to have multiple rounds of voting, and informal voting, and then formalised voting. And we relied very heavily on Stephanie Ogden, who sadly can't be with us today, and who was our GDG chair and who ran this process for us. So it was independent of WHO as well. By the end of those 2 days in May, we had arrived at consensus on 18 questions, and then there were a few questions where a bit more debate and discussion was needed, and so we did that online as well, as you can see, in August 2024. And all of this is documented within the guidelines. I don't expect you to go and look at it, but I think it is important to flag that it's in there in Annex 3, and you can get a sense of the work. And there's also an extensive web annex that goes through each of those 22 questions and the discussions, the evidence that was relied upon, and also the judgments, and then the final decision as well. So what I want to do now is run through where we arrived at. So what are these recommendations that we've been talking about for over 2 hours across the 2 sessions and people haven't yet viewed? Or maybe you have. They are available now since the 15th of October. So here they are. Please do access the QR code. I hope it works. Let me know if it doesn't. Before I dive into the recommendations, actually, let me just focus on...
teasing us here.
Let me just focus on this, because I think it's important. The guidelines are focused on community settings, and I think that hopefully that has been clear throughout. But that's not because obviously healthcare settings aren't critically important, but it's because there is WHO guidance on hand hygiene in communities in healthcare facilities, and the gap that we identified back in COVID-19 that we have now filled was in community settings. And here we're talking about households, public spaces, and institutional settings. Let's go into the recommendations then. I've just written them as they are. Obviously, the document is not limited to this. As I said, there is a chapter for each of the recommendations where we go into a lot more detail into the nuances around this recommendation. But recommendation 1 emphasises that governments should implement policy, legal, regulatory and fiscal measures to promote hand hygiene as a critical public health intervention, and that these actions should aim to remove barriers to the practice of hand hygiene and strengthen the factors that enable behaviour change and or sustain practice. And this is important because it focuses on the role of government, which I think is quite novel in this space, thinking about it, yes, as a private action and individual practice, but also as one that has public health benefits and therefore does pertain to government. And secondly, it talks about what we mean by promotion. So it's not just about educating people, it's not just about motivating people, as Bethany said, it's about removing barriers to practice as well, and very often that means providing water and making sure that soap can be purchased at an affordable price. So recommendation 2 centres on what we actually mean by effective hand hygiene. So how should you be practicing this behaviour for it to be effective at removing enough pathogens from your hands to protect you from pathogens? So hand hygiene should be practiced with plain soap and water for enough time to enable covering both hands entirely with soap and thoroughly rubbing at key times when disease can be transmitted via hands. And I'll pause there before continuing. We discussed this a bit in the morning, but those of you who weren't here, some of the things to flag is that we're recommending plain soap, not antimicrobial soap. And that's a perfect example of where those evidence to decision tables really stood us in good stead. The evidence summaries the summary that Bethany presented and that Emory University produced didn't indicate much of a difference in effectiveness between plain and antimicrobial soap, but we know that there are detrimental impacts on the environment associated with antimicrobial agents, and so that's why we chose not to recommend antimicrobial soap. Similarly, you'll note that it's not, the duration is not apparent in this recommendation. You may, all those of us, I think everyone would say, you know, what is it, 2 happy birthdays, 20 seconds, whatever it is, and it's notably absent from these guidelines, and that's because we were the evidence was inconclusive on this point, and we felt it was much more important to emphasize the technique than to necessarily emphasize a particular duration, and that's what the recommendation does. Moving on then quickly to the key times. These, I think you'll find, haven't changed much from what was out there already. In our scoping review of existing guidelines, we identified these key times, and that was really the basis for the discussion that we had, that the GDG had, and it was felt that they served to interrupt pathogen transmission at key times. So before preparing food, before eating or feeding / breastfeeding others, after using the toilet or handling feces, after coughing, sneezing or nose blowing, and when hands are visibly dirty. And the guidelines do also emphasize that there are additional times where hand hygiene should be practiced in higher risk scenarios. Finally, this recommendation emphasizes that alcohol-based hand rub is an effective alternative when hands are not visibly dirty. And I'll say that in the chapter that deals with this recommendation, there's a lot more detail on whether or not other alternatives such as ash, sand or soil, but also chlorine-based solutions and other things, and guidance is provided within the chapter that was arrived at by the GDG, and this is where we summarise those things in the guidelines. Just moving on, because I'm coming up to time. Recommendation 3, once we've sort of defined the responsibility of government, the importance to think about promotion in a comprehensive way, not just about health messaging, but about removing barriers, and then effective hand hygiene being defined in recommendation 2. Recommendation 3 then looks at what the core requirements are for changing or sustaining the practice of hand hygiene. And here the first one, probably unsurprisingly, especially given what Bethany presented, is access to the minimum material needs. So we're talking here about water and soap or alcohol-based hand rub. Secondly, we're talking about access to information on why, when, how and where to clean hands. And I know that many of you in the room may be thinking that this is one that is not necessarily, shouldn't necessarily be top 3. And there obviously has been an ongoing debate within the sector as to whether information-based approaches are the best way to go for hand hygiene. All we're saying in these guidelines is that they are an important precondition, and I don't think anyone can argue with that. It's important that people know why, when and how to wash their hands. It might not be sufficient, but it is an important precondition. And Bethany's study on behavioural enablers and barriers indicated that as well. And finally, a conducive physical and social environment. And here we get into a lot more of those motivating drivers that we discovered in the systematic review. So we talk about conducive physical environment. We're not just talking about access to those basic materials. We're talking about that access being reliable. We're talking about that access being convenient and attractive and easy to use, and those are the things that are going to drive uptake and sustained practice. And we're talking also about social environment, social norms, and really ensuring that the social aspects are also taken care of so that people are encouraged and motivated to practice the behaviour. And you can see that that is outlined here in the diagram, but also the guidelines provide a lot more detail that I'd encourage you to look at. Finally, we have a chapter on implementation, and we're going to discuss this today, so it's very apt. We, in the guidelines, we emphasise the importance of taking a systems approach. As I've said, we emphasise the role of government as in the provision of oversight and coordination, not to deliver things necessarily, but to be responsible for ensuring that those services are effective and are reaching all communities. We also emphasise the role of local government and national government as well. And completely too small for you to see, but again, just as a teaser for you to take a look at the guidelines, Lindsay's going to speak a bit more about this in just a minute, but we developed this implementation guidance with countries, and we were able to identify all of those components, those system components that lie upstream of those core requirements. So you can see the core requirements up there, or in fact in this downstream, the core requirements that we've described are there, and what services need to be in place, and what is the enabling environment that can drive those effective services, and then other institutional and structural factors as well that should help and aid planning. Apologies, I've gone a few minutes over, but I think I'll stop there.
Okay, thanks Joe. So you've seen the evidence, but you've now seen the actual recommendations. Exciting. The next bit is we're going to have a panel discussion, which I think is going to be really interesting, because we're going to get some perspectives from, I suppose, the types of people, the types of organisations that are going to pick up these guidelines and think, what does that mean within the scope of my work, whether that's in a particular organisation or it's in the context of a collaboration or engagement with national policy. So I've been given strict instructions to get people in the right order. So Lindsay, could you come up and sort of file the... right, then we've got Janala who's joining online.
Janala's a video which I can...
Video, great. Do we have Wanjiku?
I'll just double check. She wasn't online a minute ago. No, she's not. Because she would be as a panelist. So she's not.
Okay, great. Sophie Hickling, please. And then Claire. Right. So we're going to start with Lindsay Denny, who does lots of things at UNICEF, but in her spare time has been working on the hand hygiene guidelines, but she's not working on WASH, including hand hygiene in healthcare facilities. I think the interesting thing about the partnership between the World Health Organization and UNICEF is that the two organisations have comparative strengths. So obviously a lot of what WHO does is at the level of sort of guidelines, normative standards, providing that guidance to governments. UNICEF is obviously a big operational organisation, one of the biggest UN agencies in terms of sort of WASH programming. Often UNICEF staff are even embedded within government, often at a district level. So what I'd like you to talk about is, what does UNICEF do now with these guidelines? Is the stuff already happening? Is the stuff in the pipeline? Yes, so tell us a bit about that.
Absolutely. Joe, do we have a slide here where I can also reference some of the, unless you want me to talk about that after,
Yeah,
but...
you could just talk about it. The slides.
I don't think the mic works.
No, so the mic I think is for the people online, but it doesn't.
But it doesn't work.
It doesn't work to.
It is working. But
Okay.
It's not.
Sounds good.
I've not got the slide. If you could just describe
Okay.
it.
So, bit of background before talking about what UNICEF can contribute here. So, in addition to the various groups that Joe mentioned, the guideline development group, the steering committee, the group at Emory who did all the systematic reviews, we also had these champion countries, the end user group, who were consulted in this process. There are 10 champion countries that were consulted throughout. These included both in-country consultation as well as a summit last June that was brought together in Nepal to have these countries be able to speak to one another. And the purpose here was to really understand their perspectives on implementation. What does utilizing this guidelines look for them? And the chapter that Joe just referenced, the implementation chapter, was really shaped based on these conversations. I really feel silly speaking into a microphone that I don't think is working. You know, I think it was really instrumental to ensure that that was part of this. I think, you know, to make sure we're in touch with how these would be leveraged, what governments are looking for. This came from a member state demand that there were better guidance. So certainly we want to be reflecting what member states see as valuable in this. Tell me if there's anything back that we need. You know, and from UNICEF's perspective, I think, you know, it's continuing to work with those champion countries and our other country offices. Certainly, those conversations are already underway. Of course, the guidelines were only launched 15 days ago, give or take, on Global Hand Washing Day, so they had not seen the final iteration until 2 weeks ago. But already planting the seeds to say, you know, we're part of these conversations. We'd like to move ahead with you all to start piloting these guidelines and what it means to implement them. I think that's been a really big discussion for us, is what does the rollout look like? What is implementing the guidelines? We're in the process with WHO and partners to look at, you know, we're calling it a toolkit right now, but what is this implementation guidance that's going to be needed? Because guidelines are fantastic, but unless you have some kind of, I'm going to use the word roadmap, and I'm very sorry because that's a buzzy word, but some kind of plan of how we're going to use those guidelines, they're just a document, right? They can sit on the shelves. So how are we looking at the components that Joe showed in that chart at the very end there that has financing and governance and policies and all of these things? How are we ensuring that what comes out of those guidelines becomes nationally adapted and then it's inserted into the various pieces of the system? Data and monitoring, sorry Rick, all of those things. So we have started that process in conversation with countries. The next year is really going to be starting to, sorry to use the buzzy word pilot, but we will be starting to roll that out. It's not going to be limited to the countries that were the champion countries, and it certainly is not limited to who, you know, comes to us and says, I expect there's going to be countries that take this and go do it on their own, that don't ask UNICEF to support them or WaterAid. I hope that they do. But we do stand by to support those country offices where, you know, Mali, for example, has said, like, we're so excited to do a workshop to launch these. They were a champion country, and now they want to have this, like, I guess, induction workshop to start that process and move the ball rolling. So that's what I really anticipate 2026 will be. I think then it's going to be a conversation of how do we move from pilot into full-scale, you know, implementation beyond these countries that rose their hand and said they're interested. How do we ensure these other countries that maybe aren't early adopters are getting engaged in this process? And so that's something I think we all need to be having a conversation about.
Just a quick follow-up before we get to Sophie. I actually read a video from Janana. Just give us a sense of what that looks like. So we've talked about, we've got all these champion countries. Presumably there's a sort of cluster of actors. Presumably UNICEF is there, and the government. But so on the government side, which ministries, what level? Are there other agencies involved? How does that work?
Absolutely, and this is actually one of the fascinating things. We had a launch webinar, some of you might have been on a couple weeks ago, which actually had different government focal points who were engaged. Sometimes it's the Ministry of Health who's leading. Other cases, it's the Ministry of Water and Sanitation. One of the fascinating things about hand hygiene is it is so, it can be spread across different ministries depending on who takes lead. We've spent a lot of time, Joe and I and others, talking about integration. This has to be integrated. Community settings mean there's so many different, Ministry of Transportation may be engaged if we're talking about transportation hubs, marketplaces, who's responsible for that? So I think to your point, Ollie, yes, of course, the Ministry of Water should be there, but we need to be engaging a variety of stakeholders at the national and then likely the subnational and local levels to implement these. And so understanding that stakeholder mapping is going to be really, really critical. The benefit of working with these champion countries is that work has somewhat been done. We have good understanding, and you can speak to some of the work in your countries you all have worked with. In other places, that might not be as mature. There may not, I mean, COVID obviously helped us in that process, the silver lining, but I think there is work to be done to ensure the right people are around the table. And it's not just, a UNICEF-led process. These are government-led processes. This is, UNICEF and WHO are here to support. And then ensuring that there are the right, I think, Joe, the graphic you had earlier, the type of representation, like who's representing the community, who's representing all of these different groups to speak on the national adaptation piece.
Okay, so we've got a panelist joining remotely. It's actually a video because there's been some problems with connectivity. So I will introduce her. So this is Janana Chipungu, who's a researcher at an organisation called the Centre for Infectious Disease Research Zambia, CIDRAS. Janana actually heads up the sort of behavioural science unit within CIDRAS, and talking about this, I think you said the buzzword, but there was a roadmap for hand hygiene in Zambia, and Janana has been advising, working with the government on the development of that, and she was also a member of the Guideline Development Group, so the body that Joe sort of described earlier. So she's in a really interesting position. She's a researcher, she's working with government, and she's actively supporting, bridging from the guidelines to a roadmap on hand hygiene. So,
Where's the space bar, I think?
spacebar?
Yeah, that's what he said.
The government of Zambia has long recognized the importance of hand hygiene in preventing disease transmission, as well as overall health and well-being for the population. This could be seen in the COVID-19 pandemic and other cholera outbreaks, where statutory instrument has been released instructing public and private institutions to have hand washing facilities installed outside their area of operations. There have also been constant health promotion measures in the communities and across different settings. However, a more organized way of dealing with hand hygiene or promoting hand hygiene was required at a national level. The government of Zambia did respond to a call by WHO and UNICEF to have country-led hand hygiene roadmaps for all. And with support from WaterAid and UNICEF, this did happen. The development of the hand hygiene for all roadmap required us to think through how we're going to approach hand hygiene and what it should include to provide guidance to a country that's intending to improve the hand hygiene situation in the country. Evidence around different system frameworks was incorporated into the guidelines, and being a member of the Global Development Group for Hand Hygiene in Community Settings, it helped me think through the different factors that we needed to consider as we promoted hand hygiene at the national level. This includes the quality of soap, alcohol-based rub, water, the amount of water needed, the quality of water needed, the different hand washing facilities that would be appropriate in different settings. So this evidence that we gathered went into the development of the roadmap. However, we also did recognize where the gaps lay. And this was important as we finalized the document. I'm proud to say that the document does take a systems approach so that we can think of hand hygiene not as an actual behavior, but as a system that needs to be funded and a system that needs to operate at different levels of various institutions. So now that we have the roadmap, now what? Well, further research is required. In my personal view, what we need now is evidence around how can we best implement the roadmap and its activities across different sectors of the country, at community level, at district level, at provincial level, and at national level. Who should we target? How many people are required, and what budgets are there, and what would be their role in advancing hand hygiene? This, for me, is an important question that needs to be answered and to provide guidance for countries to actively roll out the roadmap. The second evidence that I think is required is to really show the impact of having hand hygiene programs rolled out. We believe that hand hygiene prevents disease and promotes overall well-being. And so as governments choose to invest in hand hygiene, we need to show through robust studies and research studies that having hand hygiene incorporated at different sectors of the economy across different ministries does have a benefit economically, socially, psychologically, as well as physically. Thank you.
Great. Obviously, I can't ask questions to Janala. It's really nice that I found to hear from Janala. As I said, she's actively engaged. She's saying, you know, the challenges. You've got a government that wants to move, wants to implement these sort of recommendations. How can sort of actors, whether it's Janala or other actors in Zambia, support the government in this? Next, I'm going to go to Sophie, who's armed and ready. So, Sophie, you are WaterAid, but you're WaterAid at a global level, sort of sitting in London, but supporting country programmes around the world, and you're in the policy team. You're a senior policy advisor on hygiene. Is that right?
Yeah,
So,
working in the policy and campaigns team.
yeah. And so, was WaterAid is this a resource? Something to celebrate? Having guidelines? How are you going to use this?
Yeah. Instead of me shouting, can I stand up? Because
You can even come over here if you prefer.
I could, but can you hear me at the back? Yeah. Okay, cool. I'll stay here. So yeah, I'm going to talk from the perspective of what WaterAid is thinking in terms of having the guidelines for our policy and advocacy work, our global policy and advocacy work. And firstly, just to congratulate you again on the publication and all the work that went into it. So I think it's really important now that we have the guidelines to not miss this opportunity to really use them to elevate our advocacy work in hand hygiene. A key part of that advocacy work has to be around the leadership and accountability piece around hand hygiene as a government responsibility, which I think the guidelines make really clear. We know hygiene is already embedded in commitments at global, at regional and at national level, but political prioritisation and that consistent financing has been much harder to secure. So I think we need to think bigger. How do we think bigger? As a sector, we need to be constantly scanning the horizon for opportunities to advocate for hand hygiene as a leader-level priority. For example, what compelling evidence or resources or packages could we put together to raise the profile of hygiene in preparations for heads of state compacts or member state preparations towards the UN Water Conference? That sort of, how do we make it a leader-level priority? The second area for advocacy, I think, is around meaningful integration across policies as well as programmes. And I think this will require us to do two things. Firstly, if we want to get hygiene in all policies, we need to understand and be really politically smart about how priorities are set and decisions are taken in other sectors. And be responsive to that then in the language we use and in the how we communicate with decision makers. And secondly, being agile to identify and leverage opportunities as they come up. And I want to use an example that we had started with the Hand Hygiene for All partners, advocating for hand hygiene in the AMR space. So the opportunities there, we know that the Global Action Plan for AMR is being updated at the moment. At the end of last year, UNGA and the high-level meetings really raised political attention on AMR, and we know that lots of the national action plans for AMR have already started expiring, so there'll be activities to review them and update them in country. So the opportunities there to integrate hand hygiene into AMR national action plans. To leverage that opportunity, I think we need, as a hand hygiene sector, to be really clear and coordinated on exactly what we're asking for. So, for example, WaterAid is doing an analysis of 20 existing national action plans for AMR, and what we're seeing is that countries already do include hand hygiene. They're not, not all of them are specific that it's hand hygiene. Not all of them, in fact, less than a quarter of them actually have a budget for those activities. So it's an analysis like that that helps us be really clear and coordinated on specifically what policy changes are we asking for. to embed hygiene, and whether that's in the AMR space or other agendas, I think it's important to have that approach of being specific. And lastly, I wanted to talk about increasing investment, and we heard it earlier. So there's an opportunity to update, I think, the global price tag that we had a few years ago, now that we have specificity from the guidelines, and then translate that into the national investment needs against costed government plans to enable resource mobilisation within national budgets. And we know that there's unique challenges to tracking financing or funding to hygiene through the system, so we want to build on existing sources like WASH accounts, again to add specificity and to be able to advocate for more funding and better or improved resource allocation for that. And a final point is that on the flip side of how much it costs to implement hand hygiene is the cost of inaction, so the cost to health systems, the cost of lost productivity. And we've seen that where it's possible to generate good quality evidence on this, that it can be really useful in getting cut through with financial decision makers, and we saw that from the work that you worked on last year with the healthcare acquired infections as well, with WaterAid and others. So yeah, so for WaterAid, I think the important things are continuing coordinated advocacy as a sector, with partners calling for political commitments, meaningful integration, and specificity in our calls for investment. Thanks.
Thanks, Sophie. There's a lot there. It's very interesting. Obviously, Janana talked about sort of roadmaps for hand hygiene. You've brought in national action plans for AMR. There are obviously other initiatives ongoing at a national level. You made me think of cholera, sort of connection with Janana, who's also been advising the government on sort of cholera control strategies. So I think there will be lots of these opportunities for how we try and embed the guideline recommendations in sort of other public health sort of efforts. Just one very quick question. How does it work within WaterAid? So you've got all these country programs, you've got a sort of policy team that's very engaged in this process. Could you talk a little bit about like the demand? Do you facilitate getting these guidelines into sort of kind of the hands of your colleagues at a country level, or do the country colleagues sort of come to you saying, is there any technical guidance out there? How does that sort of work? And do you feel there is demand at a country level within WaterAid's offices for guidance specifically on hand hygiene?
Yeah, thanks. I mean, firstly to say, WaterAid works across many countries, I think more than 20 countries, and in all of those we have a focus on hygiene and hygiene behaviour change as part of our WASH work. So across all of those countries, hygiene's really embedded. It's been a priority for WaterAid for many years, and you know, for many years we've had a priority on that. I think what we're doing now, we see the importance of these guidelines, and we will be working with WHO, UNICEF and others to roll them out, to raise awareness around them, so that countries who are already working on hygiene behaviour change programmes will be able to embed them and you know apply them as well.
Great. So you're part of this sort of country champions and all these sort of efforts in these, you know, maybe these efforts which are beginning that Lindsay talked about. And
yeah.
Great. So I'm going to go to Claire Chase, who is a senior water economist at the World Bank. And I don't think, Claire, you'll remember this, but in 2020, in the first few months of the COVID-19 pandemic, your colleagues, World Bank, organised a seminar which I was asked to speak to. And I was looking at the slides recently, and I was asked to talk for 10 minutes on what we knew about COVID-19 sort of transmission and what the potential linkages would be for sort of water, sanitation, hygiene. And there were all these question marks, and we're not sure, but we're pretty confident hand hygiene is really, really important. And I remember talking to you afterwards and saying, you know, it's really interesting, like, you know, for an organisation like the World Bank, which is often associated with investment in big infrastructure, the pandemic has sort of put hygiene onto the agenda, and it's a big opportunity to maybe sort of move that hand hygiene agenda forward. So yeah, I mean, yeah, talk to us, you know, World Bank, responses to the guidelines? How do you sort of, you know, how do you use these recommendations?
Thanks, Ali, for that memory. Yeah, so let me, this is bizarre. Let me just, I don't believe you. Yeah, so let me just say, first of all, this was a huge effort, and I think Bethany did not do it justice with this very brief presentation, but I think we should all be everyone who was involved in this should be very proud, and I think as a sector, we should be very proud that, you know, we've gotten to this stage that that we can have a very robust, solid evidence piece to help guide countries on hand hygiene, which is, as we know, an overlooked aspect of our sector. And then also just to say, I think as an institution, the World Bank, so hand hygiene was very much, there was a lot of attention to hand hygiene, hand washing with soap, kind of back in the public-private partnership for hand washing days, and then that was transitioned into the water and sanitation program. There was a lot of learning around behavior change, a lot of investment from that program to try to influence operations, the bigger sort of bank financing to do more on hand hygiene. And I think admittedly, it fell back a little bit in the priorities, but I think we're in a new era in the sense that the World Bank now has a new corporate scorecard where we went from something like 122 indicators to 22. And one of those indicators is number of people with access to at least basic water supply, sanitation, and hygiene. So it's the first time hygiene is actually in the corporate scorecard indicator. So it will be tracked at the highest level within World Bank financing. And I think that puts a lot of pressure on bank operations and our task teams to work with governments to ensure that this is being elevated as a priority. So that's just kind of an aside to say that I think there will be a lot of demand at the country level for this evidence and the guidance. Now let me get into my talking points.
That's just the warm-up.
Sorry for that aside. Yeah. No, so I think what's interesting to me about the guidelines is that I was always unsure. Are we supposed to be doing hand washing as a campaign, or are we supposed to be doing hand washing as like an institutionalized practice? And I feel like the guidelines and all the work that's gone into it that really emphasizes the role of government gives us that answer that yes, we do have the evidence and ways to ensure that it does become the accountability of the government and institutionalized within government roles and responsibilities to ensure that this is happening. And I don't think that means that we don't keep doing campaigns, because I think these can be very reinforcing, right? Whenever there's some sort of health emergency, we can think of it in a campaign environment, but you kind of have that institutionalization to carry us through those peaks and continue to learn and continue to build from that very solid basis. I think that for me is kind of the vision of where we can take this. And I think the other piece, which I think is very important and novel here, is again that it's helpful finally to sort of have all of the evidence together on the what, the how, and the why. But I think again this evidence on what it means for policy and regulation, what it means for standards, is very new, and I don't think we had that before. So I think that's for me is one of the most engaging pieces of this work. And that's exactly what I think, Bethany, you were saying, is that it doesn't mean that we take this off the shelf. There's a lot of work that Lindsay, but you both talked about, that there's a lot of work now that has to be done to adapt this to the country environment, the country context, and it's not just
it's not going to be as straightforward just in the water sector. Like it needs to be considered, and I don't think it's also as simple as just having a hygiene policy, right? I think what we mean here is that we need to ensure that all of our policy and regulation are facilitating the hygiene behaviors and the practices, and that could be, you know, when it comes to regulations around water supply, but that's facilitating the ultimate behavioral outcome. So the second point that I wanted to raise, and where I think this is really valuable, is when in the World Bank we are definitely seeing a trend towards more supporting the financing of larger scale national programs and longer term engagements. Because we haven't been so successful in changing some of the, in the reforms that are needed for achieving outcomes. And the only way you can really get to that is through these larger scale, longer term investments where you can incentivize those reforms, which are not going to happen overnight. They're going to take years, and it's a process, it's a roadmap. Whereas we've had very good guidance and evidence on what to measure for those results-based approaches, longer-term approaches, on the output side, right? We can measure the presence of a hand washing facility, whether there's water and soap, and very few cases whether people are washing their hands. We don't usually measure that, but we could. But we didn't have a lot of guidance on what to measure on the upstream, and we can't just assume that, you know, we will implement this program and we'll get these final outcomes. So I think this helps to give some guidance on what can be those interim outcomes that we can incentivize as part of results-based approaches, as part of longer-term reform efforts that can progressively make progress on hand hygiene. Lastly, I just want to, I think it also brings us to an exciting stage on the behavior change piece of it, because we don't need to iterate on some of the things that we were able to show. These are, you know, consistent drivers, these are consistent barriers across context, but it doesn't mean that we can't continue to advance the behavioral change, and that it gives the flexibility, I think, to do some of that in a more contextual setting where it's often where you need that understanding of your audience, the community that you're working with, on what are going to be the particular drivers in that setting. We can sort of go with the basics, and we can agree that those need to be there, but we can invest in some of this more innovative behavior change approaches and learn sort of what's working. So I think behavior still stays very much at the center of this, which I appreciate. So let me stop there.
That's great. Yeah, there's a lot in there, and the idea is we're going to take these issues into the working groups. But I think what I heard, Claire, it's very interesting going back 20 years to the public-private partnership for sort of hand washing. Certainly at the university where I'm based, Val Curtis was a big part of this, and I remember having a lot of conversations with Val over the years, and I suppose being unconvinced, although she tried very hard to convince me in very charismatic, compelling fashion, that hand hygiene was really a discrete area of public policy, which I think is what you're talking about. Is we need to move to institutionalising. We need to move beyond the idea of a sort of single, sort of national sort of campaign, which Val was always convinced was the next step in the evolution of hand hygiene. And I feel what you're saying is we're at that point. So thank you. We're gonna go to the. Oh, sorry.
Are you convinced now?
I'm getting there. Yeah, I'm getting there. I've seen the evidence. The WHO telling me what to do. And UNICEF in action, and there's an economist on the panel. So. Right, the working groups. What I'm going to ask is, if it's okay, if the panel, if you could join the working groups, because there might be questions or clarifications, so it'd be great for you all to be part of that conversation. I think we'll do like we did this morning, and have 2 groups. Is that okay, Joe?
Sure.
Yeah, okay. So we're going to have one group, which is going to be around this flip chart here. Is it Ellen? Yeah, so maybe, great. So Ellen in the front here by this flip chart. And then we'll have a second group over at the flip chart at the back. So yeah, just split yourselves sort of down the middle perhaps. And are there instructions on the slides, Joe?
There are not instructions, but it's essentially asking people to think about. I'm going to type these up on the slide as whilst you get organised. There's two questions really. One is, in the context within which you work, how might these guidelines be valuable to ongoing work that you're doing? But the second question, quite similar but slightly different, is do these guidelines prompt additional work within your area, and if so, what would that be?
So coming to your groups. So one group down here, one group at the back. And could you identify within your group one brave soul who will be the rapporteur? So we'll feedback at the end. But we're looking really, I think, for Joe, for maybe 3 or 4 points to feedback.
That sounds good, yeah.
On those two.
Thank you.
Do you want a facilitator later?
Yeah, that'd be great. You could do
I was wondering if
I don't to be the facilitator.
a facilitator and a rapporteur could be the same person.
All right, Joe, so how are we using the guideline? How might you use the guidelines?
Yeah, in your context, in your work, how might these guidelines be valuable to ongoing work, and do they prompt you to work differently or do extra?
Existing, future. It's very quiet in here. Robert, be loud in the back, please. Let's carry. Anyone want to take us off with on someone who might realize the guidelines for existing work?
Like in office, developing that is very handy stands for schools. It's like Harold is disbanded. So our previous I have to with or one has been innovated, and when developing this the issues which are already proven or communicated.
Alright, so looking at Washington schools and how you might integrate these in there. There is an entire one page on Washington schools specifically and like contextualization. We've also talked a little bit about how we can do like a setting specific recommendations would be a strong word for it, but like some sort of follow-on to the guidelines to help think about like the different settings. So, but absolutely, I think Washington schools is a really good example of where these guidelines could be particularly quickly implemented because there's a lot of energy momentum around washing our routines in the school setting. It's kind of easy in context, easy being a relative term. But is someone rapporteuring, by the way? I'm looking at the woman taking notes over here. Thank you. Shorter. Okay. Others? Please.
Okay, so WaterAid will support government, country in 2 ways. One, we support them to develop the national standards, whether this is Western health efficacy standards or Western school standards or an hygiene roadmap or hygiene strategy. I think having a global standard guideline is the principle helps them to have consistent standards because we have to be a right?
So it's more like the adaptation process.
Global standards can be adapted in that global context, right? For example, throughout these last several years, we have been supporting countries with hygiene strategy. We have supported Secretariat, 16 member states, hygiene strategy have been developed. So some of the recommendations that we have also coming based on our experience and our modality, we have those, but then having proven standard principle that will help them to standardize on it. That is one. Second, we model behavior-centric behavior experiment across multiple countries in multiple settings. So having these guidelines help us to create a proof of concept inferences, modeling at a small scale, utilizing this principle when we model. And then let the government scale up. For example, we have been working on integrating hygiene into immunization, hygiene into nutrition programming, hygiene into cholera, hygiene into RMNCH in multiple countries. Having these standards will actually help us to operationalize this on the ground. So the consistency you can see. And then since we work very closely with the government in the country, there are other partners also supporting the government. And if, let's say, different organizations, technical organizations go in a different way, that will dilute the program. So having these guidelines will actually help us to standardize all of us. So I think I'll put that in.
I'm gonna say a big standardization. Gosh. Keyword there.
Fantastic.
So we are also working now on the street food venue. So we are making intervention with street food vendors. So we can grab side, you can use of it.
Love that.
Water is very because there's a lot of environment strategies to the practices in your street vendor.
And as a researcher, that is an area that doesn't have a lot of research. So thinking, I mean, you know, I'm not going to be implementing or like, but as from a researcher point of view, I'm listening to the next question, and I'm thinking that like that would be a great contribution to thinking about like how we're going to be continuously adding to the just because the knowledge. Really, really important.
Yeah. I have a follow-up for you. So I'm curious, for street vendors where you are, do they have to get a license at all? Because maybe there's an opportunity to think about how this is something incorporated with the way they have to, like if they have to get a license or they have to, you know, in addition to like training for people who are not licensed or anyone, but I'm just curious, how does becoming a street vendor, is it anyone can do it, or is there a process?
Yeah,
Regulations?
it's informal sector.
It's informal, okay, great, yeah.
But it makes me think about in America, if you go to any restaurant, you'll see the sign that says employees must wash their hands before they return to work. But like, you know, in your context, what is the equivalent for street vendors that kind of gets that? Yeah.
I have a small example for impacting ongoing work. I used to work in the refugee space.
Okay.
And so like procurement guidelines, like don't procure antibiotics, so procure regular soap. I think UNICEF has something specific where it's like the standard what you should be procuring for antibiotics.
Great example.
Sorry, NFI.
Oh, sorry, non-food items.
Thank you.
So with my WHO hat on, not my JFK hat on, I think this would be really useful at the country level, where our country offices are interfacing with government partners around health. And this makes it clear that there is an important role that governments need to play in facilitating hand hygiene for health. So I think that will be a new set of tools and arguments to advance that agenda at the country level.
Yeah, would I call you guys advocates to say like country advocacy or country like dialogues essentially around health?
Yeah, country dialogues is good.
Technically you're not advocates, I guess.
Well, but I mean,
But you are.
pointing out what the supporting evidence-based decision-making and programming, you know, we're all about that. We love the evidence-based. And, yeah, for WHO, not for me personally, if I look back on like the guidelines for drinking water or sanitation, they set out the evidence base and some recommendations. They tend to be then followed by a lot of other tools like water safety plans or adaptations to rural settings or humanitarian settings or whatever. There's going to be a whole constellation of related products that WHO will probably want to see developed over, you know, not the next year, over the next many years, to help operationalize these
We're already in discussions on it, yeah.
different contexts.
All right, anyone else? Go back to you.
Well, and I was saying that all of the WHO had that, I think it applies also to
Well,
same sex.
yeah. Maybe not the guidelines themselves, you can also refer back to the research if you'd like.
Yeah. I don't have much thoughts, sorry. Oh, you're fine. But I agree with what everyone said. I just haven't thought it through in the context of kind of overseeing the portfolio of work that we deliver. So, yeah.
So think of, shift how you would think about new work. Beyond ongoing work, street vendors, etc. Very exciting. Schools. If you were to, what did she say? How you might prompt, how might it prompt new work that you would undertake?
That's what I have. I'm like, we're done.
Don't make me present
Those
this
ones
again.
are fine. Those ones are good. But the comment from Rick also, like, talking about the tools to come. You know, the implementation, there's a lot to learn from implementing. So, it also some of the comments from Sophie and Claire, like, as a researcher, you know, I think there's a lot of huge opportunities from implementation science to see how this is delivered. Like, how are there champion countries that we can learn from, for example?
I think we should have a championship candidate.
I know. Yeah.
A duel to the top. Yeah.
Was a good one. But I think we learn how it's implemented in order to improve how it keeps getting implemented. You're talking about a pilot. I love pilots. I don't think it's a bad word. But, you know, doing from a pilot, you learn how to do it better the next time. And so you need that sort of effective going out in that way. There's a ton to be learned around. It's a really big element for some. And it's also, you know, I think it's the ministries of the perks are some of the ones that have gotten, a lot of work. And so getting some of that information around how much does it cost, how much does it cost to implement that. So there's a whole bunch to add to that.
Yeah, I think on our end, I mean, we had these really long conversations as we were developing the guidelines, and I came in kind of towards the end of this, but from the UNICEF perspective, where there was going to be a chapter on implementation. Not they have a chapter on it more like how government's involved, but like what is that implementation toolkit chapter, right? And it was coming together in a way that like we spent 4 years developing the research to get to the guidance, that it felt like we were kind of like last minute throwing it in this chapter. It felt like it wasn't doing that justice. And so we decided to pull it out and think about like, we can start, and we're working on this now with Joe, is like we can have some tools, we talk about this countries should use, but if they're not, we're not going to go and print them and say these are like the final things yet. Like then you can pilot it, and you can test it, and you can have feedback from lots of different groups and users, and to say like, how do you use these guidelines? And we don't know that yet. And then I'm sure at some point we bring the researchers in to say like what's working and what's not working. And so I think it'll be iterative. My hope is that we'll have something, we'll have something maybe reviewed by the end of this year. Next year we bring in the partners, WaterAid, to start kind of looking at this and say like, let's try it out in Believe and see like how that goes and what the feedback of the country says. And then kind of like build it from there, because I do think there was so much time spent making sure the guidelines were evidence-based that we can't, I mean, we can't not implement them. We can't stop people from implementing. That's not smart. But at the same time, to say like this is the implementation guidance and that's it, would not feel like it's doing justice to the time invested into those two things. Like that would be very difficult.
Yeah. Just wondering in terms of, so obviously each implementation will be context specific. So is there room for kind of process evaluations to kind of start now as the pilot implementation is happening, so that you can have maybe guidelines more around the process that can then be related to different contexts? I don't know if that's something that researchers are thinking about doing. Or...
Yeah, I mean, because there's going to be some, to your point, that implement that necessarily getting they're going to be an example of this is Janala. She was working on the GDP, so she had all the inside info. And during at the same time that the guidelines were launched, Zambia launched its roadmap for hand hygiene. Yeah, and so they are running. And so that's okay, so here's an early adopter, what's happening here?
Yeah.
Right? So there's and maybe some of that is, monitoring who's starting to pick it up? What pieces are picking up? Like what are the working, what are the harder things? So I think for sure we could do something else in terms
Yeah. I think in terms of it being like a big undertaking, I think financially,
Yeah,
there's a lot of
exactly it.
yes, but I think there was a decent amount of money to do this whole work on the guidelines development. That funding does not exist in the landscape right now. So yes, but on a shoestring.
Yeah.
But on basically.
Okay, so can I build a little bit on this? I think since we started talking about Zambia, one of the reasons why Zambia has been championing into this because UNICEF and WaterAid in particular, we have been working with the government. We have done the Kutuba campaign. We have been introducing the behavior centers and it was since the last 5-7 years. Done the formative research, several proof of concept behavior centers campaign was happening on the ground. When the global hand hygiene roadmap initiated, Zambia became one of the champion countries. We have been supporting government for long.
Yeah.
And then later on, we hired Janal to support facilitate a consultant to write our roadmap. It's not because of one discussion, but because of government commitment. We supported by parties. So how many countries around the world that we find have a dedicated support to the government, and government is actually willing and able to support it, right? So I think that is quite important when you look at the sector we need to look. We should not think that this new toolkit is going to resolve everything by this.
No.
And I think it's not. We have been implementing since last 40 years, colleagues. I really would like to blunt. There are certain things we're not backing with evidence. This evidence will actually help us to blind. But there are principles, established principles already into the sector. We need to build from there, right? So, so I'm not sure how this toolkit is going to be developed because the context here what matters. Because if you're looking for designing a robustly designed behavior-centric behavior change campaign, looking the local behavior determinants and hygiene differentiating, that has to be context.
To be clear, the toolkit is linked to the guidelines. So it's not telling you how to build a hand hygiene program. It's going to say like, these are the guidelines and this is how we're recommending they be rolled out under governance. So it's not going to guide you on the things that you've been doing for 40 years. It's specifically linked to those.
Absolutely. I mean, let me conclude that one. so then what we need to look is actually if we are producing something centralized, these kind of guidelines help us to standardize the program. When it comes to operationalize them, so this country, the relevant context is quite important. And then we need to be flexible in this kind of tools that the country can adapt in different settings, in a different context, because hand hygiene is quite diverse, quite multidisciplinary. If you go and talk about these hand hygiene, 5 critical moments, absolutely different in healthcare settings, different in school settings, different in community settings, and government, if we are talking with one government, going into the community does have a school, community does have a healthcare facility, it's one standard aspect, it's not going to work. So therefore I think we need to be agile in terms of context, hope these kind of tools help us to be flexible.
I don't want to interrupt, this is a great discussion. We are going to have to come back together in about 30 seconds, so...
Last word. Yeah, so 2 things. One, I think that the guidelines in and of themselves are an advocacy and communications tool to elevate the importance of hand hygiene. Like that in and of itself is like, full stop, is a tool. And so whether or not it's whatever the context being applied, you are elevating by just using the guidelines and that the guidelines exist. But I think what was interesting that I added to my comment that I wrote down for myself was that there's already champions that exist in water and sanitation. There's already champions that exist that we work with at all levels, all the time. And so just using, making them aware of that also elevates this component. So I think that there's an opportunity there. And then the last thing that I'll say for new work, because that's kind of from the last one where I was writing things down. So I think that there's a huge opportunity from a new work perspective is storytelling. One of the things that I have found very fascinating in my job as an advocate over the years is that you can find the red thread over a long period of time. So exactly the story you just told, which was a very abridged version of everything that led up to what is happening in Zambia right now, is a story that needs to be told that you can do, for example, looking back at all of the different indicators and everything that's been measured in Zambia over a long period of time. But each of those things, an outcome harvesting, so flip it on its head, to demonstrate that those stories are things that we don't often hear. The entire story from beginning to end, we hear, oh, Ghana has like this new thing, or Zambia has this new thing, or whatever, but you don't hear about the arc 15 years to get there. So I think
Okay,
for me,
I think we're gonna, if we could just sort of wrap up. Okay, so we're gonna have very quick feedback, and I think the UNICEF WHO team are gonna record the feedback and carry this into the process. And then we've got closing remarks from a senior sector official, thinker, leader. Okay, Robert, are you rapporteuring?
I think so.
Okay, go for it. Nice big, loud voice, please.
How many?
Do you want the fake microphone?
You've got a lot, huh? Oh wow, okay, it's 2 sheets. Could you just give us the highlights? Let us know which question before you give us the, very much the highlights.
Things kind of address both future work and ongoing work in terms of how the guidelines can support what we're both doing and how we're looking ahead. I'm very rapidly trying to read my own handwriting. I think a lot of it was how the guidelines provide an opportunity. I'll just focus on one aspect here of both kind of supporting engagement. They provide a clear roadmap for working with government partners, for working with on policy, kind of that aspect, which is often kind of an amorphous area that we often kind of struggle with how to get government what they should be doing. There was I picked that one because there was a phrase that was said, not just our traditional partners that we think of, the NOH or the Ministry of Health, but thinking more kind of these other partners. This gives a clear pathway for engagement with the non-traditional ministries or government partners as well. And I liked the phrase, moving from a hygiene policy to hygiene as part of every policy. So I'll stop there, there's other stuff to read.
Okay, yeah, really useful, thank you. Is it Ellen?
Yeah. All right. So building off of that, we also talked about the importance of using the champions that we already have. So using this as like an advocacy tool, the guidelines as an advocacy tool with those champions we already know. So I agree, Robert, what you said about kind of expanding to new, but also seeing how we can make sure that they are serving as our champions. We talked a lot about using these as like to set national standards or to contribute to national standards. When national standards exist around other things, how can hygiene be incorporated into that? And then using them in ongoing programs. So using them as an opportunity to start to incorporate changes in the programming that you're already doing. We talked about this, particularly it was really interesting, we talked about not only wash in schools, which there's already kind of movements and things around, but things like street vendors and how do you get this as a way to incorporate hand washing and hand hygiene with street vendors. And then I'll just go into looking forward. We talked about toolkits, we talked about the interest in additional research about like more process type of research, like how is it being implemented and what can we learn, and storytelling and like identifying red threads. We often hear about the last thing that happened. So the guidelines were created, but today even we talked about the entire process and years that went into making that happen, where there is examples like the story we heard from Zambia, what happened for the 5 to 10 years in advance of that to get to the point where they are now, and figuring out how that kind of thing can be replicated in other places. I'm sure there's a lot that I missed, but someone can take a picture of my notes.
That's great. Okay, thank you very much. Brilliant session. I've asked Rick Johnston, WHO and UNICEF Joint Monitoring Programme. He's the WHO lead, and I guess you've got new data out on hand hygiene, so part of this.
Oh, well, I've got a new list of things to be working on is what I've got. So actually I have a lot of detailed thoughts and reflections that I'm not going to make you sit through. I want to make 2 points though, and the first is just huge congratulations, an immense amount of work done really rigorously. I joined WHO 12 years ago, and since then we've been saying, how is it that there aren't guidelines on hand hygiene apart from what we have in healthcare settings? So just thank you for getting this done, and big round of applause for everyone. And the second point is that your work is done for today, but it opens a whole new door, and we heard from the panel, we heard from the working groups. I've got ideas about new things that we can do to operationalize, to fill gaps. There's going to be a ton of work that derives from this. I have a feeling this is going to be one of those products that's very influential when we look back on it in years to come. So I think we'll have lots more sessions here and elsewhere thinking about how those guidelines in hand hygiene, after they were launched back in 2025, how they really informed a lot of work to come. So again, congratulations.
Wow. I feel really excited, Rick. Brilliant close. Thanks everyone. For those of you here this morning as well, thanks for coming back. Any questions? Joe from WHO, Lindsay from UNICEF. So yeah, stay in touch. Let's keep this moving.
Thank you, Ollie. Thank you. Lindsay was running. Does anyone want the photo of my notes?
Maybe Joe, Joe, do you want to photo of my notes?
Yeah, I'll take one. Or somebody. Yeah, do you want me? Do you want to take it, or do you want me to just send it to you? Sorry. My handwriting is small, but it's very neat. So hopefully, I was noticing that. The second session from now. Yeah, and I have some from this one. So I can't, if there's something you just understand, and you want me to type them up and send them to you that has an access box, please let me know. I'm happy to do that. But it's good enough at the moment. But, I mean, that's part of being here, right? Thanks, guys. I'm excited. This is great. I mean, and it's starting me on my.
I was gonna say, does this help, like,
yes.
I mean, not to say guidelines is the exclusive part of your thing?
No, but I think it's deeper. It's much broader.
Maybe
That's
yeah, other ones.
Absolutely.
And it's the second thing.
Yeah. And I told Lindsay this earlier, but I did get a hold of the consultant, and he does have the interviews, so I think that we're gonna have to be able to bypass like initial re-interviewing all of it. So I don't have them in hand yet, but we're working on it. So
I'm gonna send a note. He wants proof of.
yeah, he said.
So I'll send a note when you guys see the same. Robert. Yeah.